If I need to micromanage you, I don't need you in that job. That's not my role to micromanage you. I don't have the bandwidth to micromanage people.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a really special guest, Dr. Patrick McGill. Dr. McGill, can you please introduce yourself and your current role?
Yeah, thanks for having me. So, Patrick McGill, I serve as the Chief Transformation Officer at Community Health Network. We're based in Indianapolis, Indiana, mid-sized health system, typically serving people in central Indiana. Um, we have about 1,500 employed providers and do everything across the board except for pediatric subspecialty and transplants. So, as the Chief Transformation Officer, I have responsibility from everything from IT and analytics, population health, value based care, regulatory reporting, clinical informatics. I have some operational areas as well, such as home care, hospice, palliative care, geriatrics, care in the home. And then I have a new area, personalized medicine, which is high risk clinics, genetics, genomics, high risk screening. And I'm a family physician, still see patients 1 day a week.
Thank you so much for coming on. You have an impressive resume. Of course, you've been with Community Health Network, according to LinkedIn, about almost 15 years now. So that's
Right.
that's impressive. And then you've worked a lot in informatics, clinical transformation, of course, as well as in strategy and analytics. So you have a great kind of overview of everything that's going on. Indiana, of course, there's some more rural areas. But as for Indianapolis and the community that you serve, are you serving more of the urban, suburban, or are you also serving rural as well?
The nice thing about Community Health Network is we have a mix. So we have our East Hospital is really that more urban, near east side of Indianapolis, kind of an older area. Um, our South Hospital and our North Hospital are more suburban hospitals, really kind of verging on urban, suburban. The South one is on the near south side of Indianapolis, so it has a mix of suburban and urban. And then our two hospitals in Anderson and Kokomo are really more rural hospitals, and the one in Kokomo is very rural. So that makes the network very interesting because we have the entire diversity of urban, suburban, and then rural hospitals and the patients that we serve, and that brings all the needs that we have, whether it's social determinants or transportation or other needs across. How do we deliver services to meet the patients that we serve?
And that's a big benefit to our audience as well, because we have audience members, of course, primarily urban areas, but we're also really trying to do a lot of work with rural. And so the fact that you cover that spectrum is important. One of the things I wonder, though, coming from a transformation perspective, does having such a diverse patient population, I mean, that must make it a challenge when trying to do organization wide initiatives. Do you have any tips on how you're able to manage organization wide initiatives, such as maybe an EMR, EHR rollout in the rural areas as well as in the urban areas?
So I think it's oftentimes when we think about transformation, or let's just say new projects or new initiatives, we often try and think about this kind of one size fits all. And so we're gonna pilot it at one location, and then we're gonna spread it to everywhere, and everybody better love it because that's what they're getting. And I think when you have a mix across urban, suburban, and rural, um, there's different challenges. So I'll take transportation for example. We have our own transportation service that's been funded by our foundation. Some very generous donors have funded it over the years. So as you think about it, urban transportation, and so these are the cars that we provide. I should say that we provide cars. We have a couple vans. So urban transportation, suburban transportation, and rural transportation are three completely different problems to solve, especially as you're trying to bring people to more tertiary quaternary care. And so, we started in the urban because that was the easiest one. It's more contained. It was a contained location. And then we spread it to suburban, and then we spread it to the rural. But we had to solve different problems each time that we did that. So I think it's more of this continuous learning and mindset about how do you roll out these improvements and not just try and implement a one size fits all. That's really what transformation's about.
And then how do you identify the differences? Are you going out in, I mean, I know you said you're a family physician. Are you going out and working in these independent communities to kind of see on the ground what the problems are?
Yeah, so we work very closely with our clinical and operational leaders throughout the network to understand what problems they're trying to solve. I mean, I always joke and say, go into a clinic and just spend 30 seconds, and they will be happy to tell you all the problems that they have that they need you to solve. I mean, that's no shortage of problems that we need to solve or challenges that they are trying to have addressed. And so we work very closely with those. I think the fact that I still practice, and I practice in that suburban urban area on the south side. And so the fact that I still practice gives me firsthand knowledge of the problems that we're trying to solve or that we need to solve when it comes to clinical practice. Historically, I've practiced in rural areas, and so I understand some of those. So it's a combination. It's a combination of our informatics team, our clinical and operational leadership team, or frontline team, and then it's really a group effort about the problems that we need to solve.
One of the questions that I've been wondering, because you have this great overview and you're working with these individuals, is when it comes to population health management. Would you say, when it comes to urban versus rural with population health management, um, is rural more challenging, or is it just a different set of problems?
I think it's a little bit of both. I think it's certainly a different set of problems. I think there's, I don't know that it's well. I take that back. I don't know that it's necessarily more challenging. I think it's just a different set of problems.
And I ask that just because, in Philadelphia here, we have, of course, a very urban environment in Center City, Philadelphia, but it drops off fairly quickly after. And you get in, within the same region into some very rural areas. And it poses the question of, do we see sometimes, I guess what I'm asking is what's the benefit of having such a large institution like yourself covering multiple areas? Does it help with synergies across rural and urban? And also, how do you form those synergies, right? Because at one time, I'm assuming there was some separate systems and then now they've merged together. So how do you get those to work to benefit each other?
To take care of those patients when they need the higher acuity services, that's one problem to solve. The second problem is, again, there's services that we can provide to those rural areas. I'm thinking about technology now. Technology that in a historical setting, when they're independent, they would never be able to afford the infrastructure, some of those other tools. And so we can deliver those services because of the economies of scale. And I think that's so again, I take back what I said that I think I don't know that it's necessarily more complex. I think it's just different sets of problems. We have some of those same problems to solve in the urban areas as well. But again, it's just a different set of problems.
A lot of people worry about what's happening with the Walmart Health and other organizations where in retail, right, Walmart would move into a town and it would disrupt a lot of the local retail, and then when they leave, there'd be a hole that's hard to fix. And so, as a lot of these rural systems become part of larger, primarily urban-based systems, there's some concern about that happening again. Where do you think we're heading in the future? And when you think about telemedicine and AI and all these different things, usually we are seeing it first in urban areas, but when it comes to telemedicine, we're seeing it first in the rural areas. What do you think the future looks like? And then also, how does that tie into that concern of, these healthcare deserts forming?
Yeah, I think telemedicine can absolutely serve a purpose, and it has served a purpose even prior to the pandemic for specialty care. You think about teleneurology's been around for a long time. Telestroke. Um, we're partnering with some of the rural locations for things like infectious disease and endocrinology and some of those types of specialties that are more amenable to telemedicine. Now, things like surgery and OBGYN, those need to be in person. So I think it's incumbent upon the system to really help retain the culture of that rural location. And so we have a uniform culture across our organization, but I would definitely say our more rural hospital, the two rural hospitals, have their own identity because those people live in that community, they work in that community. I think it has a unique culture and identity, and I think that's important to what you're talking about. I don't know that, at least in our area, that we've seen this consolidation and removal of services um, to result in a healthcare desert. I think it's actually the opposite, where it builds that connection to retain some services that may have become healthcare deserts if there wasn't a broader partnership. And again, partnerships can occur on many different levels. It could be just a shared services. It could be a formal merger and acquisition. It could just be a clinical partnership.
So what you're seeing is these partnerships are increasing the availability, which is excellent. So part of that though, that goes down to that independent culture. Is there any friction that occurs because of that? It seems like it would be challenging at some point, right? When you have different cultures working together, is there any friction that goes on?
There's always friction when you're bringing cultures together, but I think that's where leadership comes in. I think that's where um, change management comes in to just work through the changes and understanding of the different cultures, and it takes time. I think these things occur over time and they evolve. But I think that's where solid leadership and some of the solid change management principles are very important.
Are there any principles specifically that have been valuable to you as the chief transformation officer that maybe you could give some of the younger early careerists to use?
Yeah, first and foremost is listening. I think you have to listen, you have to understand. Um, I think that oftentimes we go in and we think we know the answers, and we may not. And so it starts with listening. Um, the flip side of that is oftentimes we can listen to the point of being frozen in decision making. So there has to be a little bit of courage to say we've listened and we've heard everybody. Fair process. Our organization is a big proponent of fair process to say we're going to hear everybody, we're going to get everybody's input that we possibly can, and at the end of the day, this is going to be the team or the person or the committee that makes the decision. And I think when you can go into some of these change managements with fair process, so that's transparent, um, that can alleviate a lot of problems down the line. Transparency is the third one I would say. Being transparent in the initiatives, transparent in communications, and just honesty.
When you came aboard as the chief transformation officer, have you ever had to struggle with, or maybe you haven't, and just any advice in general, but you know, it's tough because you're expected to really transform, right? And so you are the chief change agent, really, of the organization. But sometimes, even among the C-suite or among high level managers, there is still some resistance to change because people do not like change. And so I think the first question is, have you always liked change yourself? And if not, is there anything that got you to the level where you are now in this position where you're always looking for change?
I don't know that I've always liked change. I think that I've always had this desire to make things better.
Mm.
So my wife has this saying of always be better. And that's not meant to be in a competitive I'm better than you or I'm going to beat you type of way. It's just always you can always be better. You can always learn more, you can always be the bigger person, you can always listen more, you can always be more understanding, just always be under better. So I've always, even going back to when I was in high school, college, and med school, always had this just desire to how can we make things better? How can we make the system better? How can we make patient care more efficient? How can we make the experience better? And I think that has led me down this journey. I don't have a technology background. I don't have a data and analytics background. I don't have a process improvement background. But it's this um, ever burning desire to say we can make things better. We can make it better for patients. We can make it better for caregivers. We can make it better for the system.
Some organizations struggle with that a lot. Would you think there are ways to get an organization to change their culture, even if there are only one or two people kind of at the top who share that mindset? Or do you think that it's best to seek out organizations that already have that mindset? I hope you understand, I hope that makes sense.
I I think I understand the question. I think what you have to do is it all change starts with somebody, right? There's the butterfly effect. There's the tipping point, whatever cliche you want to use. But I think that you got to have the right ingredients. We have support from the leadership. I report to the CEO. I sit on the executive committee. So I think you have to have change agents at a high enough level in the organization to really drive and impact change. I think that's one problem that a lot of organizations do. They bury the change agents 5 levels down, and those people just get burned out and frustrated and end up ultimately leaving. So I think your organizational structure matters, and I think that having the right ingredients also matters to be able to drive some of that change as well. So, I don't know that every organization has that culture out of the gate, but I do think every organization can have that culture out of the gate. I don't think people go into healthcare. I think people go into healthcare because they want to help people. They want to make people better. They have this desire for the better for for the better good. And I think you can leverage a lot of that.
And then on that note about how it is possible, of course, for organizations like you're saying to have that out of the gate, was your role the chief transformation officer position? Is that a new position for the system, or has that existed for a while?
No, it's a new position. So I took the role in 20 um I took the role in 2021, 2022. It was really more of a title change. I was previously the chief analytics officer, but I had a lot of the same duties. I had IT, I had analytics, I had population health, I had our direct to employer, some of our payer relationships, some of our strategic partnerships like Walgreens and others rolled up to me. So in 21 or 22, whenever it was, we effectively just changed the title. But that role in and of itself, the title was new. The role had evolved over time, and again, what we tried to do was organize ourselves. If we want to drive change, and we want to drive change through process improvement, through payer relationships, through patient experience, through technology, you got to tie those things together in a single vertical to be able to break barriers, bust the silos, and drive initiatives forward.
And I've seen a few, one of the things we're doing is we're meeting with the top kind of 100 chief transformation officers. Of course, you're one of them. And so it's a new role for you. And from what I'm seeing with others, it's also a new role in a lot of institutions. I've been asking this question. It comes down to time management because it's kind of a concern when looking at the role. You have a lot of responsibilities. There's many different things that are now rolling up into this position. I've spoken with another individual, and it's a similar thing at his institution. I want to ask, how do you do that time management, and would you recommend that role at other institutions? Because it seems like there's a tremendous amount of things wrapped up into this one kind of position.
I think you have to have the right person. I think you have to have the right mind. That person has to have the right mindset. And hey, I'm not naive enough to or short sighted enough to say I have an incredible team that surrounds me. I could not do my job without the team that surrounds me. I have an incredible CIO leader of IT. I have an incredible analytics leadership. I have incredible leaders of population health. I have an incredible informatics leaders, people over and leader over personalized medicine, a leader over our experience analytics. I have incredible leaders around me that share the vision, share the desire to change and transform, and they wake up every day thinking about how can they make things better for Community Health Network Central Indiana, the patients that we serve. And so I think that's one of the keys, right? A lot of these organizations will put a chief transformation officer in place and say, you're on your own, go do your job. That's impossible. We've spent some time over the last few years really honing and developing that team, and I give them 99% of the credit.
I appreciate that because that is kind of a big point, right? It's not this one person who's going to handle all of the work of these 5 or 6 people that are underneath you. You're helping to connect the people together is what it sounds like.
I always tell them, look, what you need from me, I need to give you the vision, the strategy, the direction, and then get out of the way. I'm here
That's
if I need to break a barrier for you, if I need to help with ideas or visions or other resources. But one of my number one roles is to get out of the way and let them do their job. They're the experts, and I need to empower them to be the experts.
Yep, that's excellent, and that also makes sense. I think why your organization probably does so well on the transformation and the partnerships is because you're having that perspective, right? No, it doesn't sound like it's a very micromanagement heavy organization.
I mean, I kind of tongue in cheek joke with them and say, if I need to micromanage you, I don't need you in that job. I mean, that's not my role to micromanage you. I don't have the bandwidth to micromanage people.
I'll leave a kind of a final question. I really appreciate your time, and this is again going back for the early careerists here. Is there anything that you have done or any skills that you have that you'd recommend for younger people, such as myself, who want to get to that chief transformation officer role or who are interested in working in change management?
First thing I would say is it's hard work. So you've got to be willing to work hard. You've got to be willing to constantly learn. And so never let a door that's open for you, always go through that door that's open for you. So I can think back over my career, doors that have opened for me that maybe I could have said no, but I took the chance and went through. And it worked out because I was willing to put the work in to learn. And then the third thing is uh, surround yourself with good people, good mentors, good good peers, good people on your team. I think that matters as much as anything else. But it's this burning desire to always learn. I think when it comes to transformation, that's probably the thing that's going to set people up the most.
Thank you so much for coming on. I think that that's a really excellent advice here. I'm going to have to write that down for myself, of course, as well. But excellent advice. Really appreciate your time, Dr. McGill, and thank you for coming on. I hope we can have you on again in the future.
Absolutely. Thanks for having me.